There is an old saying that you should never lie to your doctors. Why is it so? Let us see in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week a health related topic is discussed via video. If you want to see such videos, subscribe to this channel. Also, press the bell icon adjacent to the subscribe button to get instant notifications whenever new videos are released. Today we are going to discuss why we should not lie to the doctor. I am not saying every patient is knowingly lying to the doctor, but we often don't reveal the complete truth to the doctor out of shame, out of guilt, or we think it is not necessary to the doctor, so we don't tell the truth. Is it harmful? Is it harmful to us patient ourselves? So let us see in today's video. I classify this untruths into 5 different types. The first group is a lie. You blatantly lie to the doctor. Why does it happen? Often it is to conceal whether we have not taken our course, whether we have not completed, whether we have skipped. We just lie to the doctor that we have given it so. I'll give you an example. One of my patients brought his child to me. He had a throat infection. I examined him, diagnosed it, and gave treatment. The prescription consisted of antibiotics, symptomatic drugs, and antipyretics, that is fever reducing medicines. The patient came back to me after 3 days with actually worsening of symptoms. I examined the child again. The throat infection was not improved. In fact, it had become worse. The child was sick. I had to plan about investigating, escalating the medicines, or even admitting the child. I inquired to the parents whether they have given the prescription in full. They replied to me that they have given all medicines, still the child has not improved. So I had to admit that child, give injectable antibiotics, do investigations. After the child got better after 3 days, just before discharge, the mother came to me and said, "Doctor, out of your prescription, I did not give this one medicine," because she was an educated mother. She thought antibiotics are generally harmful, so I should not give it to the child. So she didn't give it. She didn't even admit it at the time when I asked her after 3 days, because she was worried about whether I will admonish her or anything. So she didn't reveal it. So just before discharge, after 3 days of admission, inpatient care, she said, "No, I didn't give the antibiotic in the first instance." So the lies are going to increase your treatment cost, increase your risk, generally going to prolong your illness. The second category of untruths is half-truths. What are half-truths? I'll just illustrate you with an example. Again, one of my patients who had fever for more than 7 days came to me. I diagnosed and gave a prescription. After 5 days, they came back and said about the child not eating well, being generally tired, and the fever continuing. I examined the child. I found the child to be recovering from the illness. Child was otherwise well. And when I asked about the fever, they said, "No, still the fever is there. It's a very light fever." I specifically again asked about what is the temperature of the child. They said it was only 98, normal temperature. Then why did they say about this fever being light? They thought because the child is tired and not eating well, according to the parents, they thought the fever is also there, and they just added it so that the child gets the extra care. No, the child will obviously not get the extra care, probably will be given unnecessary medicines. The third category of untruths is exaggeration. We often exaggerate the symptoms. Again, very recently a patient came to me with symptoms of cough and cold. When I inquired about the history, the patients told that the cough and cold was there from the previous visit itself. The previous visit was almost 3 months ago. I specifically asked them, is it the same or is it decreased in between now, or is it increased? No, the parents were adamant that the cough and cold didn't get better at all during these 3 months, and the child is suffering. Every day the child is not able to sleep. So if I take these symptoms at face value, we have to evaluate for tuberculosis and other chronic diseases like asthma or reflux disease, because the cough is present for more than 3 months. So I specifically told them that this is the plan I am going to do, because if these two are not separate illnesses and the illness is continuing for 3 months, I have to do all this. Then hesitantly they said, no doctor, that illness was fine. This illness, the present illness, is only 3 days duration. But since they both had the same symptoms, I thought if I say that it has not improved, probably you will give better medicine, and also this is a frequent occurrence. Cold is a very frequent occurrence. It is commonly known to occur recurrently. That's why it is called common cold. Secondly, the symptoms, though they are the same, they can be two different illnesses which are manifesting. So don't exaggerate just so that thinking you will get better treatment or you will get extra care. The fourth category of untruth is about withholding information. Again, I'll quote an example. Very recently, this week, a parent brought their child to me. They said about an illness which was of 3 days duration. I asked about the associated complaints. I asked if they had been to any other doctor or if they had given any other medicine. They vehemently denied, saying that I was their only doctor. So I wrote a prescription for them. 3 days later, again they came back to me with the persistence of symptoms. Now the mother said, doctor, for the same complaint, I had taken the child to another doctor on day 1. They had given me a prescription. She showed the prescription. The prescription which the first doctor gave and what I gave had the same medicine. Because they concealed, they withheld that information, I also gave that medicine without knowing that it has not worked in the child even after taking it for 2 days. Ultimately, it led to prolongation of illness. The last category of untruth is making inferences. What is the problem with this? Without having sound technical knowledge, we make inferences as to the cause, the reasons, and even the diagnosis of the disease itself. People often say when they have throat pain, they have throat infection. And people assume reasons for the symptoms. I'll quote with an example. A grandparent brought their young child, a 9-month-old child, to me with complaints of cold. I examined the child, found the child not to have any great degree of any respiratory infection. I was diligently searching for any signs, but the grandparent was lamenting about the cold being present from birth itself, not getting better. Finally, I asked, is there any other symptom? The grandmother again said no, but when she was lamenting about the cold itself, she uttered a word that cold or mucus is going from above and below. I asked her, what do you mean by above and below? She said the child has been vomiting and child is having stools. In both there is cold or mucus. What she meant really was the child is having a gastrointestinal infection and the child is having loose stools and vomiting. Vomiting contains mucus, and loose stools, especially if it involves large intestine, can have mucus-like substance. So she inferred that it is due to cold, and she said the same to me. So out of a busy practice, if anybody had not have enough time and asked a good history, she would have received the wrong treatment. I am not saying doctor will not spend the time with you, but you have to help the doctor by giving the accurate history without holding anything back and saying about the treatment what you have already taken. If any tests were taken, also inform them to the doctor. Thereby you will get the correct and the better treatment for yourself. These are the reasons why we always say be truthful to your doctor or never tell lies to your doctor. Friends, hope you would have liked this video. If you like this video, share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.